registering with the French healthcare system can take up to 6 months. True or false?
Yes, that's correct. So it can take a little bit of time to register for French healthcare. If you are moving to France and you are not working, so you're maybe an early retiree, you have to have been in France for 3 months to be able to actually start your request for French healthcare. So already you have a little 3-month wait, and in that 3-month period, you should make sure that you have private health insurance. After that, you should really apply as quickly as possible because it can be a long process. When you make your first application to receiving what we call a temporary social security number, that can take around 3 months. And this number allows you to have medical reimbursements the paper way, I like to call it. So you receive your invoice from the doctor and what we call a little brown form, which you send off to your local reimbursement office. I talked about that earlier, and they will then refund you in your bank account. After another 3 to 4 months, this number becomes permanent. And at that point, you can ask for a card, which is called a carte vitale. It's a medical reimbursement card, and it just stops you from going through that long paper process. So your doctor, when you go to visit that doctor, they will ask you for your carte vitale. They put that in their machine, and then your local reimbursement office gets a message to say that Ellen, for example, has paid 25 euros. We need to reimburse 70% of that onto her bank account. So it just kind of cuts out that paper process. But from applying at the very beginning to then receiving your carte vitale can take 6 months. So be patient and just make sure that you're ready before you move, that you've done your research and that you get all of your documents ready so that you can really speed up that process.
Fantastic. So there's a 3-month period at the start where you're definitely advisable to take out private healthcare. And then from the end of that period, potentially for another 6 months, there's a period where it could be more administration in terms of paying and then getting the refund. And then hopefully after that period, you could consider yourself registered if that's gone smoothly.
That's correct. That's correct. And I just wanted to actually add something about that. Your medical reimbursements are kind of backdated, so to speak, to when your local reimbursement office receives your application. So let's say in those 3 months before you get your temporary social security number to get reimbursements the paper way, you will then actually, if whatever you've paid in those 3 months without that number, you can actually get reimbursed. So those are backdated.
That's really clear. Thank you.